Welcome to myacademy.com. I'm Professor Mahfooz from Pakistan. In this video, VMCQ 4.2 will deal with the lid MCQs part 2. First of all, we'll try to differentiate between entropion, ectropion, trichiasis, and ptosis. EN for entropion and IN for inward. So entropion is inward turning of the lower lid. It may be lower lid, but most commonly it is the lower lid. So entropion is inward turning of the lid, while the trichiasis is in inward turning of the lashes. So here only the lashes are turned inside. So this is trichiasis, and if the whole lid turns inside, that is entropion. Ectropion is outward turning of the eyelid. So here the lower eyelid has turned out, so this is ectropion. And finally ptosis, droopy lid. Look at the lid here, is droopy as compared to the other eye, and this is called ptosis. And in these MCQs we'll only discuss the ptosis to start with. A very important slide about the ptosis. Ptosis can be divided into congenital and acquired. The following 4 or 5 MCQs will be only concentrated on this thing. Congenital ptosis is because of maldevelopment of levator muscle. Levator muscle is the muscle which pulls the lid up. Then acquired ptosis is of 4 types: involutional or aponeurotic, neurogenic or paralytic, mechanical, and muscular. Involutional or aponeurotic is age-related weakness or disinsertion of the levator. Remember, disinsertion of the levator or weakness of the levator. So these are the causes for the involutional or aponeurotic ptosis. Neurogenic ptosis is paralytic. When the nerve supply gets paralyzed of the third cranial nerve, that causes the ptosis, in addition to the diplopia and squint. Then is the mechanical. Anything that increases the weight of the upper lid, like a tumor or edema. Any tumor or edema or anything that increases the weight of the upper lid causes the upper lid to droop, and that causes mechanical ptosis. Then is the muscular ptosis. Trauma or weakness. Weakness is because of the neuromuscular diseases or muscular dystrophy. These diseases like myasthenia or muscle dystrophy can cause ptosis. So congenital ptosis is because of maldevelopment, and acquired ptosis is either because of the weakness or disinsertion. Neurogenic ptosis is because of third nerve paralysis, so the other sign and symptoms of third nerve paralysis will be present. Mechanical ptosis is because of increased weight, and muscular ptosis is because of the weakness of the muscle due to different diseases. Now the next few MCQs will be based on this slide. Let's start. First MCQ is: a 79-year-old patient developed droopy eyelid. The most likely diagnosis is, now remember, is droopy lid. Congenital ptosis, ectropion, entropion, involutional ptosis, or mechanical ptosis. So first you have to decide which condition is it. It is not entropion or ectropion, but it is ptosis. Now it is 79-year-old, so it cannot be congenital ptosis. There is no mention of any lid swelling or growth on the lid, so it is not mechanical ptosis. So most probable diagnosis is involutional ptosis. Let's see. Involutional ptosis is the answer. Next MCQ. A 32-year-old girl is complaining of droopy lid, which is more prominent in the evening. Now that is the key in the slide, in the evening. So it is not always there, it only comes in the evening, and that points out towards a muscle weakness. So the cause may be disinsertion of levator aponeurosis, paralysis of levator muscle, dystrophy of levator muscle, or weakness of levator muscle. Disinsertion of the levator is a permanent condition, so it cannot be only in the evening. Paralysis is a permanent condition, so it's not in the evening. Dystrophy of the levator muscle causes permanent ptosis, so it is not only in the evening. So the answer can only be weakness of the levator muscle, like myasthenia gravis can cause tiredness in the evening as the day goes along and can cause ptosis. So the answer will be weakness of the levator. Let's see. Weakness of the levator muscle. Next MCQ. A 32-year-old girl is complaining of droopy lid with double vision which comes and goes. Comes and goes means it is not permanent, and double vision means it's also causing problem with the other muscles. Again, the disinsertion of the levator and disinsertion of the levator aponeurosis is not possible because the condition is coming and going. It's not also paralysis because paralysis is all the time there. Dystrophy is all the time there. So it's the weakness of the levator muscle because of the myasthenia which comes and goes, and because of the weakness of the other muscles you may get the double vision as well. So the answer is weakness of the levator muscle. And the answer is weakness of the levator muscle. Next MCQ. A 61-year-old diabetic is complaining of sudden onset of squint with droopy lid. The most probable diagnosis is disinsertion of levator aponeurosis, paralysis of levator muscle, dystrophy of levator muscle, or increased weight of the lid. Now look at the stem. Sudden onset of squint with the droopy lid. So it cannot be the first two, it cannot be the last two. It's the third nerve paralysis which causes muscles of the eye to paralyze, which cause squint, and also because it supplies the levator, so it causes droopiness. So it would be the paralysis of the levator muscle. Let's see the answer. Paralysis of the levator muscle, and it is neurogenic ptosis. A 75-year-old man has been diagnosed having involutional ptosis, so the diagnosis is there. Etiology may be. Now remember from the first slide, etiology of the involutional ptosis is either disinsertion of the levator aponeurosis or weakness of the levator muscle. It is not disinsertion of the levator muscle, it is disinsertion of levator aponeurosis. Paralysis of levator is not the probable answer. Dystrophy or increased weight are unlikely answer. So the answer would be disinsertion of levator aponeurosis. Let's see. Disinsertion of levator aponeurosis is the answer. Next MCQ. A child has born with a droopy right upper lid. Most likely etiologies. Again, it was in the slide. Long levator muscle. No. Maldevelopment of the levator muscle. Maybe yes. Maldevelopment of superior rectus. No, there was no mention of superior rectus. Small levator, no mention of that. Stronger than usual levator, no mention of that in the slide. So the answer would be maldevelopment of the levator muscle as it was in the first slide. And the answer is maldevelopment. Let's first recap what we discussed. Ptosis can be congenital or acquired. Congenital because of the maldevelopment of levator muscle. Acquired is 4 types. Involutional is because of the weakness or disinsertion of levator aponeurosis. Neurogenic is because of third nerve palsy. Mechanical is because of the increased weight of the lid. And muscular is because of the weakness of the muscle caused by myasthenia or muscular dystrophy. And now we'll discuss the treatment, and the next few MCQs will be based on the treatment or management. Management is medical management and surgical management. Medical management is the treatment of the underlying disease like myasthenia, or if an abscess is causing increased weight of the upper lid, we can treat it with the antibiotics. So that is the medical treatment, which is not very common, because the most common causes of ptosis are involutional and neurogenic, and the treatment is mostly surgery. First of all, treatment of the tumor causing the ptosis is not a very common for a tumor to cause the ptosis, but whenever it is, you can treat the tumor, or you can drain the abscess at times, and that can resolve the ptosis. Most common is involutional, and involutional can be mild or moderate to severe. Mild ptosis can be treated with the procedure called Fasinella Servet procedure. Mild to moderate, which is like 3 to 4 millimeter ptosis with good levator function. Remember, moderate to severe ptosis with good levator function can be treated with levator resection or levator reinsertion. On the other hand, moderate to severe ptosis with poor levator function is treated with bro suspension, also called sling procedure. So the MCQs, next few MCQs will be based on this. Mild ptosis, Fasinella Servet, moderate to severe with good levator function, levator resection or levator reinsertion, moderate to severe with poor levator function with the bro suspension. So let's start with the MCQs. A 77-year-old has a progressive droopy lid for last 7 years with good levator function. The operation of choice is, so 77-year-old means involutional, and it's also progressive, so that points out towards involutional. Remember, good levator function. The operation of choice is bro suspension, Fasinella Servet, levator resection, sling procedure or Weiss procedure. Bro suspension is for poor levator function, Fasinella Servet is for mild ptosis, levator resection may be the answer, sling procedure is with poor levator function, and Weiss procedure is not a surgery for the ptosis, so the answer would be levator resection. Remember, good levator function, the operation of choice is levator resection or levator reinsertion. So answer is levator resection. Next MCQ. Right, the same stem, 77-year-old has progressive droopy lid for last 7 years. Operation of choice is bro suspension. No, because that's for poor levator function. Fasinella Servet is for mild ptosis. Levator reinsertion is the answer this time. Instead of levator resection, the choice is levator reinsertion. Sling procedure is for the poor levator function, and Weiss is for the entropion. So the answer is levator reinsertion. Levator reinsertion is the answer. The next MCQ is, a 77-year-old has a progressive droopy lid for last 7 years. It can be 77, 87, 57, 78, and it may be for last 7 years, 9 years, 8 years, 6 years. So that's how we can change the stem. So the stem is progressive droopy lid for 7 years with poor levator function. Operation of choice is, this time it is not good levator function, it is poor levator function. And remember, the operation of choice for the poor levator function is bro suspension, which is also called sling. So sling operation may be a choice and the bro suspension may be a choice. Fasinella is out, levator resection is out, Quicket and Weiss are not for ptosis, so the answer would be bro suspension. And bro suspension is the answer. Next MCQ. Same stem, 77-year-old has a progressive droopy lid for 7 years with poor levator function. Fasinella Servet is not answer. Levator resection is for involutional ptosis. Sling operation, which is also called bro suspension, would be the answer, as these two are not done for the ptosis. So the answer is sling procedure. Sling procedure is the answer. A 37-year-old has agreed for a surgical correction of the mild ptosis with good levator function. Following can be done: fascicular cervet, bro suspension, Wise procedure, sling procedure, tucking of the upper lid. Tucking of the upper lid was not mentioned anywhere. Sling is for poor levator function. Wise is not for ptosis. Bro suspension is for the poor levator function. So we are left with the choice fascicular cervet, and that would be the answer. Fascicular cervet procedure is the answer. Thank you very much for being with me, and please do give your feedback. Thank you.